Hello, I'm Dr. Mark Gittleman from Optimal Health Miami, and today I'll be showing you how to reconstitute your medication. Some hormones and supplements come already pre-mixed, and some come as a powder and need to be mixed with liquid in order to be used. This process is called reconstitution of the medication. Certain types of HCG needs reconstitution, as does typically B12 and virtually all of the growth hormone releasing peptides. The process is the same regardless of the medication being reconstituted. You will receive a box with 2 vials. One vial will have a powder and the other vial will contain a liquid. The liquid will be either normal saline or bacteriostatic water. You really don't need to worry about which liquid it is because I will direct the pharmacy which liquid goes with which product. But if you are reconstituting more than one medication at a time, please be sure to not confuse the liquids and use only the one that comes with the product. Mixing directions will be on the box and will reflect exactly the concentration and dosing that I would like for you to use in reconstituting the medication. Please follow these instructions. If you think there may be an error in the mixing instructions, please get in contact with one of our patient care coordinators via text, email, or on the clinical hotline cell phone. Now, take both vials out of the box and pop off the plastic tab that comes on each of the bottles. Needles, syringes, and alcohol swabs will be provided to you by the pharmacy. Use the alcohol swabs to clean off the tops of the bottles, rubbing in a circular motion 3 times. Then turn the bottle with the liquid upside down and insert the needle and syringe into the bottle. There'll be a label on the bottle which can sometimes block your view of the needle. So rotate the bottle until you can see the liquid easily and can be certain that the needle is within the liquid part of the bottle. Then draw up the recommended volume. That number is determined by me, and it will be a number somewhere between 2 cc's and 10 cc's. Pull the plunger down so that the appropriate amount of fluid fills the syringe. Be sure to push extra volume or liquid or air back into the bottle so that the syringe now has exactly the number of cc's as specified. Incidentally, we use the term cc's and mLs interchangeably when we talk about volumes to extract or inject. You can now remove the needle and syringe from the bottle, then pick up the bottle with the powder in it. You have already cleaned the top with alcohol. Now just insert the needle and syringe into the bottle and inject all the liquid in the syringe into this bottle. After all the liquid's in the bottle, remove the needle and syringe and gently swirl the solution until there's no more powder to dissolve. There's no need to shake. The swirling motion should be adequate to dissolve the powder fully. Now you've reconstituted your medicine and it's activated and ready to use. In general, all reconstituted products require refrigeration after, not before, reconstitution. HCG, B12, and growth hormone releasing peptides such as sermorelin and ipamorelin always need to go in the refrigerator once they are reconstituted. The powder for each of these does not need to be in the refrigerator as it's not yet activated. Upon reconstitution, the solution becomes activated and must go in the refrigerator. If you have any questions whatsoever, please feel free to text, email, or call our patient care coordinators anytime during business hours. Their email addresses are on their card. But for reference, I will give you the number for our clinical hotline cell phone, which is 305-778-6058. And for reference, the Optimal Health Miami main phone line is 305-466-9000. I hope this video has been helpful for you. We know that the more comfortable you are with your program, the more likely you are to adhere to the program we've designed for you, and in turn, more likely to reach your own personal health goals.